just thank you, Lord, that you've given us the blessing, Lord, of living in the freest country in the world, Lord. Others look at this country, Lord, and from all around the world, Lord, just look up to what we have always been, Lord. And many say, Lord, if we can't go to America for freedom, where will we turn? I fear that freedom has been slowly slipping away, Lord, over the years, Lord. And certainly you say in your word, Lord, that if we just turn from our wicked ways and turn our faces back to you, Lord, that you'd hear from heaven and heal our land. We thank you, Lord, for the forefathers that you gave us, that gave us a Declaration of Independence and a Constitution, Lord, that makes us free, Lord. And that needs to be adhered to, Lord. So I pray for a revival, Lord, a turning back to you, Lord. I pray, Lord, that you would give us leaders, both in Washington, in our states, and in our local communities, Lord, that would serve you well, for if they serve you well, they'll serve their countrymen well. I ask these things in Christ's precious name. Amen.
Thank you, Lord. We have a few people here tonight from other campaigns. Zach Carrier was with Ted Cruz's campaign. Were you happy? Was he happy with our?
It was amazing.
Was it?
Yes.
Good. And we have Molly Nepner. She's with Rubio, and I'm trying to get him. You have the poll. Get him for me, please. And Mariah Halleck, who my son-in-law accosted her in the driveway in Bedford and saw her Ohio plates and stopped to talk to her and found out that she is with John Kasich. So, if we have an invitation to you, would like to come as well. Just let us know. Okay, we have Keith Carlson here tonight. Keith is with the Healthcare Compact. Keith Ammon recommended him to come and talk to us for a few minutes. The Healthcare Compact creates accountability, innovation, and flexibility by putting states instead of the Washington, D.C. bureaucrats in charge of your healthcare policy. So you would like to speak to us for a few minutes, Keith?
Thank you. Another Keith is handing out information. Mini Keith. I just wanted to first say I was at the event on Sunday, the Ted Cruz event, and I've been to a lot of presidential speeches, and I really appreciated the way it was designed, where there was the singing in front, the national anthem, but it wasn't like really long. And then we got into the program, and then you had lots of question and answers. And there's a microphone, so people are actually able to hear the questions. Because a lot of times you're at these presidential events, and only the people right next to this questioner can actually hear the questions. But this event, not only was it recorded, hopefully the recording will be awesome because people actually be able to hear the questions this time. So I thought you guys did a really good job with that. Thank you, Tony. And it's great to be here also with Senator Sanborn. I'm not saying this because he's your senator, but actually Senator Sanborn is also my favorite senator. And I'm actually called him here, so I really appreciate Senator Sanborn being here, especially because he's a healthcare expert. But so I'm hoping he asks me some tough questions. But I wanted to talk about the Healthcare Compact today, and did everyone get some information from Keith? Excellent. So I have another handout. It's on the back table along with the Marco Rubio and the Ted Cruz and all that stuff event. And I'll talk about that in a second. But the handout, really quickly, I can just talk about it. The Healthcare Compact, basically, the first page is just quotes from experts, because I'll tell you myself in a second, but I'm not a governor or a U.S. senator or a secretary of state like the people on the first page. And the second page briefly describes what it does. And then the third page briefly describes how it passes. So I'm Keith Carlson. I came from a military background. Does anyone here serve in the military? Thank you very much, sir. So my grandfather served 30 years here in the Korean Wars, and he had my dad on a military base. My dad and my brother both served here in Vietnam. And as soon as I got out of high school, I served in the military. And I was in the medical field, so I have a little bit of experience with a nationalized bureaucratic medical program working with the VA and the Army healthcare. And so what the healthcare compact does, it's actually, first thing, let me just say, it's an interstate compact. So that might be confusing to some of the people here. What is an interstate compact, right? So you've heard of bills, and you know there's 28 amendments to the federal constitution. I hope I got that right for any experts here. And then there's conventions. So states can have conventions, and there can be a federal convention. But there's another way to change the federal rules, and which is, again, it's an interstate compact. So if anyone has a constitution with them, if you go to Article 10, Section 1, Clause 3, it's the compact clause. I can share this with people if you don't own a constitution. But basically, there's a clause in the Constitution that allows compacts, which is an agreement between two or more states. So, for example, New Hampshire's a state and Maine's a state, so they could get together and create some agreement. And in fact, there's over 200 of these compacts in existence, these interstate compacts. New Hampshire's involved in over 30 of them. So if you've never heard of them, perhaps you have a driver's license. New Hampshire's involved in the National Driver's License Compact. Or perhaps you've driven on the bridge that crosses, well, there's multiple ones, but you've driven on a bridge that crosses from New York to New Jersey. So that's another compact that creates that bridge. New Hampshire, like I said, is involved with 30 of them. There's a flood one that some people around here are aware of. Massachusetts apparently owes us a bunch of money for flooding, which they refuse to pay.
$4.5 million, if my memory's right.
There you go. So the healthcare compact, what it actually does though, so it's an interstate compact, it's an agreement among states, and it does something really unique. It basically does three things. So it enables the states to basically eliminate federal law. So I'll give you an example. So New Hampshire responded to ObamaCare in multiple ways. One of the things New Hampshire did is it said we don't have to pay the tax if we don't have health insurance in New Hampshire. This was a bill that passed, and unfortunately, if anyone here has ever filed and not had health insurance, when you file your federal taxes, there's a spot on your electronic filing that says, you know, the shared responsibility tax is the name, but you could call it the individual mandate or whatever term the Supreme Court wants to call it at the time. But this is a tax that the New Hampshire law says you don't have to pay, and yet people in New Hampshire are paying. And the reason is because New Hampshire law is not over federal law, generally speaking. The way the healthcare compact works, though, since it is a federal thing, it actually enables the states to supersede federal law when they want. And in this particular case, with this compact, it's the healthcare regulations. So there's thousands and thousands of pages of federal healthcare regulations. And even before ObamaCare, there were still thousands of pages of federal healthcare regulations. So it's not like ObamaCare with its over 20 taxes on the people. You know, Obamacare taxes you if you don't have health insurance, but then if you have health insurance, it taxes you. But then if you have good health insurance, it taxes you. And if you're a charity hospital that helps people that can't afford health insurance, it taxes you. It taxes you, you know, if you get medical devices or if you get prescription drugs. So it taxes you every way possible. But even before Obamacare, there was Hillary Care, you know, which didn't pass, but it almost passed. In Tennessee, where I originally come from, they did pass a modified version of it. They finally got rid of it because it was a huge failure. But so the point is, Obamacare wasn't the start of our centralized bureaucratic process, where these bureaucrats in DC control our health care. But Obamacare made it a lot worse. So for example, previously our congressmen, our congresswomen, our senators used to control healthcare policy for the nation, and the states used to have a lot of authority. But under Obamacare, now it's all these bureaucrats on these commissions in DC. One of our former vice presidential candidates referred to them as death panels. And I'm not going to do that, but basically, she's right in that these panels, these commissions that are set up by Obamacare, totally control healthcare policy for the entire nation. And not only are, in some ways, not always, but Senator Andy Sanborn's hands tied, but even our congressperson's hands are completely tied in a lot of ways when it comes to healthcare. People that, you know, can't even pronounce the name of our capital city right now, people that have never been to most of the states, now make the decisions for every single person. All 330 million people that live in America, all of these unique people in all these unique states with unique needs are all decided by people that have never hiked or can't even pronounce Mount Monadnock or have never, been to your rivers. So that's a serious problem. These people you can't meet. Whereas obviously, if you come to a meeting like this, I see at least two representatives. I hope, is there a third representative here that I missed? Okay, I see at least two representatives and a state senator. These are people that you can actually meet, you can talk to. They actually apparently come to the local library on a nice night for no reason at all. I don't know why they're here, but it's good that they are because you're able to go. Right. Sorry, Keith. You're nothing else to do, I guess. But you can actually meet these people where there's bureaucrats that control all healthcare for everyone. No one even knows their names, right? So with ObamaCare, that's the problem. But what the Healthcare Compact does is the first thing, the tens of thousands of pages of federal health regulation, it enables people in this state to override by just passing bills that eliminate them. And so the second thing is it block grants of the the Medicaid, and if we also agree to it in New Hampshire, the Medicare money to New Hampshire. Some states do it one way, some states do both. But basically it block grants a lot of healthcare money to New Hampshire, and like I said, with zero strings attached. Right now there's tons of strings attached. So if you could eliminate all the strings, all these efficiencies would develop, and we'd have a lot more money, we could do a lot more things with that. And then the third thing, it sets up a non-binding advisory commission. And this commission is just set up to create, or actually to figure out what the best practices are. So if something works in Iowa or something works in Texas, that's great. So we can look at that, we can study that, we can adopt it in New Hampshire. And under the Healthcare Compact, we're actually able to do that. Under current law, if something happens in Texas, well, first of all, they can't produce it. But let's say they were able to violate federal law and create some kind of, or they were able to negotiate with the federal government, for example. That does happen. And create some kind of loophole where they're able to fix some healthcare problem. Well, we would have to go through that entire process, negotiate with the federal government, get the approval of President Obama, which is a very complicated process for every single individual change, whereas under the Healthcare Compact, any changes we wanted to make, we could just make. We could just make them. We'd have to pass a bill, of course. It would be debated, it would be discussed in New Hampshire. It wouldn't just be, Governor Hassan just passes something. It would be the people of New Hampshire decide on something. And I'll be the first to admit that the Healthcare Compact is not perfect at all, and different presidential candidates have different policies, and none of them are perfect either. There's no perfect solution. The people have tried, what is it, like 100 times to abolish ObamaCare in Congress, and obviously it hasn't worked. If Senator Cruz or if Senator Rubio becomes the next president and they eliminate ObamaCare, that's going to be very difficult, first off. But Senator Cruz said what he's going to do is he's going to make every congressman, every congresswoman, Congress critters, I like to call them, they're going to have to fall under ObamaCare. So they're going to get a lot less coverage, it's going to be more expensive. But the problem is the members of Congress tend to be millionaires, so they can afford to pay whatever they want for health insurance. But even if he was able to convince them, and even if he's able to somehow get 60 votes or whatever in the Senate to end ObamaCare, again, it doesn't really solve the problem. Obamacare is just a symptom of nationalized healthcare, bureaucratic healthcare. Look at every other industrialized first world country. We can look at countries that are controlled by conservatives, so-called even, like Australia and Canada and England. Conservatives, Israel, conservatives supposedly run these countries, and yet no one ever talks about eliminating bureaucratic healthcare that's controlled by the central government there. It's not even an issue that's brought up. And that's going to happen to America unless not only do we repeal Obamacare, which is obviously an important step, but we get the federal government out of control of our healthcare policy. We enable the 50 laboratories of democracy, as some people call it, in the states to create the best policies, the policies that work for the people. And so I'll give you an example where, the Healthcare Compact might not be the best system. I know most people don't want to present something and then talk about how it can be bad, but I'm okay with that. So for example, let's say Texas passes some kind of legislation, some kind of free market reform that people think is great under the Healthcare Compact. And let's say it actually hurts people in Texas. So that is a problem, and that could happen. But thankfully, it didn't hurt people in the other 49 states. So the system we currently live under, if there's a problem in Congress, if the bureaucrats that don't know anything about us create some type of regulation that hurts people in Texas, it'll also hurt people in the other 49 states. And so, yes, there could be problems under, the healthcare compact, but those same problems currently exist and are magnified by 50. And the great thing about the healthcare compact, it's enabling legislation. So, for example, 4 years from now, if New Hampshire joins the other 9 states that are part of it, New Hampshire can, if we decide it doesn't work for us, we can always leave it. It's not like you're forced into compacts. States leave and enter compacts at will. So it's the perfect situation in that we can figure out what works for us. If somehow it doesn't work for us, we can leave. Something like ObamaCare is the opposite approach, where everyone has to join it. You can't read it. You don't know what it is. The local people have no opinion, no power, no decision making. We're just pawns in a system, and we do whatever they tell us. So it's the exact opposite approach. You could say it's a conservative approach to healthcare reform. It actually was created in Texas. I talked to Senator Ted Cruz at his office opening this weekend, and he told me he actually wrote a white paper supporting it years ago. And there's actually, so I was speaking of that, the Kansas Secretary of State wrote every member of Congress in the 9 states that have passed the healthcare compact. He wrote them in June and July. And he actually explained how, in his opinion, and I put this on the table back there, this is the only solution right now to Obamacare. Because clearly we don't have enough votes to override a veto of the president right now. But some people, including the Kansas Secretary of State, actually believe that the way the interstate compacts work is they don't need approval by the president. So in his paper, he says, it is important to note that compact clause does not require the president's signature. Only Congress needs approval. So he's saying that even without a new president, but hopefully, obviously, we're going to have 8 years of Republican president. I mean, we can look at New Hampshire. We're kind of a bellwether. We've had 3 special elections for state rep this year. Every single one went Republican. And we even had an alderman at large race in Nashua. It's a nonpartisan, but the Republican candidate won. So things are looking really good for Republicans right now. I'm not trying to discourage that. But my point is that some people are suggesting that, this is the solution right now. We don't even have to wait 3 years for the next president to implement something, or 6 years, or however long it takes. So that's what I'm trying to talk to you about today. And there's more information. The website, our Twitter, or Facebook is on those papers. If you have any, if you want to look it up, if you want to share with people, there's more pages on that table back there. And I just want you to imagine the possibility of you being in charge of healthcare instead of, people that pronounce our capital the wrong way. Just imagine that. And thank you very much. Are there any questions? Sorry, Bill, for moving around. It's hard to stand behind the mic. Yes, Keith.
So you said there's 9 states that have passed.
Yes.
Are they waiting for Congress to approve it?
Yes, so there's House Resolution 50, which is in Congress right now. Several U.S. senators have written Fox News articles about this year, and it's in the House of Representatives right now, the bill. So Representative Doug Collins of Georgia is the primary sponsor, but it seems like every week or so it gains a new sponsor in Congress. And so let's say it passes Congress 3 years from now, or let's say it passes a year from now. It doesn't matter. New Hampshire can still join it later. It's the way the compacts work is once a compact's created, states can join or leave. They don't have to wait, or there's no stipulation like that. Thank you. Yes?
So we could join the compact for Texas, that Texas has type of thing, or would it be neighboring states?
Great. So some of the compacts, it's they're rigid in what you can do. With this compact, any state that joins it can interact with any state in any way it wants, and is able to eliminate any and all federal health care regulations, like ObamaCare related and previously related. So it's not necessarily important whether, although Texas is one of the 9 states that's joined it, it's not necessarily important that Texas has joined it or hasn't joined it. If New Hampshire wants to eliminate the requirement that X, Y, Z, really any requirement we want to eliminate, we can do that with or without Texas. Yes, follow-up?
Yes, and how does that impact you if you're traveling? So you're in California, which we don't have a compact health insurance with, and you fall and you hurt yourself and you have to go to the emergency room.
I'm not a policy expert, and I don't actually have to be, because thankfully, there's a lot of state reps and state senators that are, and then there's going to be this commission that's created. But it's, right now, you know, you have health insurance, right? And so, if you're in California, you'll be covered. All this does is enables the states to eliminate regulations that make health insurance more expensive. So very likely, it would be a very similar situation. You would probably just pay, who knows, half as much a month and have twice the coverage. It's really up to the state legislators to figure out the perfect system. But right now, we know that the system's wrong, and it's only getting worse. I mean, I could have talked about some of the problems with ObamaCare. For example, the Cadillac tax. In fact, in Manchester, that's one of the main things. They're having elections this month in Manchester for primary, and that's one of the main things they're talking about, because the mayor of Manchester just vetoed the school budget, and some of the candidates were claiming the school budget was designed so that the Cadillac tax won't hit them, but the mayor said, well, either way, it still increases expenses by so much it breaks the tax cap. But really, what your point is, again, we have health insurance now. Basically, what's going to happen is it's going to cost less, and there's going to be better benefits, most likely.
So it has nothing to do with the insurance companies itself.
Correct.
It could enable states to reduce regulations. So, for example, right now, I have to have pregnancy coverage.
Right.
And so New Hampshire could eliminate that, so my health insurance could, you know, the price could drop.
Okay, got it.
Yes, sir.
The way you're explaining this is this will basically, if, let's say New Hampshire was to adopt this and it passes everything, we don't have Obamacare in New Hampshire.
It would enable the state of New Hampshire to eliminate ObamaCare,
So if
plus whatever else they want to eliminate.
So let's say every state, with the exception of California, left coast, adopted this, that would be the de facto death of Obamacare right there, is that correct?
I believe so. I can't guarantee, you know, who's going to be the next president, because like I said, Hillary created Hillary Care, which is, you know, just as bad as ObamaCare. So,
And do caucus care.
right. Okay, well, thank you everyone, and I look forward to our next speaker.